So you've moved to Vietnam. The coffee is amazing, the food is healthy and addictive, and the cost of living is nearly unbeatable. But there's one thing many expats don't think about before it's too late, and that's their health insurance. In this video, we'll break down everything about expat health insurance in Vietnam. How does it work? What does it cost? How to choose the right provider, and other key factors in making a decision to protect your stay in Vietnam. Let's start with why this matters by looking at a bird's eye view of Vietnam's healthcare system. Vietnam's public healthcare system is improving, but it's designed primarily for locals. If you're using this system, you can expect language barriers, long waiting times, and limited care. This is why most expats turn to private clinics and hospitals for their healthcare. This can be at places like FB Hospital, Family Medical Practice, Raffles, Vinmec, the American, the French Hospital, and many more. Such hospitals require you to have one of two things. One, you pay out of pocket. Two, you have health insurance. They have no obligation to treat you, even in an emergency, without one of those two things happening first. The difference being, you'll have English-speaking doctors, shorter wait times, more modern facilities and equipment, but that comes at a cost. Without insurance, routine doctor visits can range between $30 to $200, depending on where you go. A outpatient surgery could be $3,000 to $5,000 US. A private room in an international hospital can be between $200 and $500 just for the cost of staying in the room, not including all the costs of why you're there, such as the surgery and all the related care. Major surgeries can be between $10,000 and all the way up to $100,000. We've had clients this year with in excess of $90,000 US for things like back surgeries. So unless you're prepared to pay out of pocket for these things, it's important to have your health insurance in place before something happens. When it comes to choosing a plan, for our clients, we look at providers into three core categories: one local, two regional, and three international. So let's look at what that means. Local providers are based here in Vietnam. They're denominated in Vietnam Dong. They're designed for the cost of healthcare in Vietnam, and they're not designed for you to take it if you leave Vietnam. While they're affordable, they do come with some downside risk. Things like stricter claims, more waiting periods, very hard to get pre-existing conditions covered, limited direct billing at major hospitals and clinics in Vietnam, and no direct billing outside of Vietnam. Providers like this include Bao Viet, PTI, PVI, Bao Minh, Liberty Vietnam, Pacific Cross Vietnam, and more. The next category, if you want to take a step up, is our regional providers. They view insurance not solely based on Vietnam, but the Southeast Asia region as a whole. It's a nice blend of what you get versus what you pay. So it's the most higher benefit limits, modern user experience with things like Members app, wide cashless direct billing in Vietnam and outside of Vietnam, and things like digital claims, which the local insurers don't have. Such providers include Luma, April, Morgan Price, IMG, Exxon Global, and many more. The last category is our true international providers. These are the big expat insurers where you may know their names, such as Cigna, Allianz, AXA, William Russell, and many more. These providers are going to cost the most, but they're also going to have the most modern key features, and there's no tie to Vietnam or no tie to Asia. So you can take these providers while you live in Vietnam, but they can follow you no matter where you go in the world, except for a few countries. So when we're looking at which providers do we recommend, it's basically local is going to be your most budget friendly, that comes with limitations. Regional is going to be your best value, all things considered. And the international is going to be your most expensive, but also your highest quality and the most modern. Now let's talk about benefits. What do you get when you take out a policy in Vietnam? First, we look at the coverage area. Where do you need coverage? Just Vietnam, regionally in Asia, worldwide excluding the USA, or worldwide including the USA? Other benefits are the actual insurance benefits, which are broken down into two core categories. One is inpatient. This is a mandatory benefit. Inpatient covers you for things that require you to stay overnight in a hospital. So think of things like surgeries and extended hospital stays. Things that don't happen frequently, but when they do happen, they cost a lot of money. This is a mandatory benefit. It often includes evacuation within that. Outpatient is your next key benefit category. Think of this like your routine doctor visits, where you go to a hospital, you go to a clinic, you see a general practitioner, you see a specialist, you get some tests, you get some medication, and you go home. Which benefits you want? It's really up to you. What we do is we help you compare your benefits between inpatient only and inpatient and outpatient, and help you make an educated decision. Annual health checks are another key benefit. Some providers, they cover this as an add-on. Some providers, this is built into the outpatient section. Other optional benefits that you can add in are things like routine dental and vision and maternity. The last thing to think about is direct billing. Not all providers offer cashless direct billing. Most will have their own network. Some providers outsource their direct billing to a third party, and you can get inpatient direct billing only. Some providers, if you have inpatient and outpatient, they don't offer outpatient direct billing. While that may sound like, hey, I don't want that, I don't want to have to pay up front anywhere, oftentimes those providers give you a premium discount for you paying up front and then going through the claims process. Which benefits are you interested in? Talk to Tenzing today, and your advisor will help you go through all of your options, explaining how they work so you can make an informed decision for you or your family. The million-dollar question: how much does health insurance in Vietnam cost? Well, it depends. I know that's not a great answer. It depends on so many variables, whether you're talking about local, regional, international providers, whether you're talking about age, whether you're talking about one person or a family of four, what key features you have in place, whether pre-existing conditions are covered or not, whether there's cashless direct billing in Vietnam, regionally, or all across the globe. Plans can be as cheap as $200. They can be as expensive as $20,000 per year. Which provider and plan we recommend? It depends on what's important to you, your preferences, and your budget. Now, a lot of people, they need to make a concession. They may need to not have a benefit that they wanted initially. Maybe their coverage area is a little bit lower than they wanted. Maybe they have a deductible on their plan. Maybe a pre-existing condition that they thought would be covered isn't covered. Keep in mind, insurance is just like anything. Typically, what you pay and what you get are correlated. So the cheapest insurance, it's going to come with some downside risk. It's not going to work like a well-oiled machine because they simply don't have the premium, the margin, to cover everything. If you're looking for the smoothest user experience, we'd recommend a regional or international provider. If you're looking for something to just tick a box while you're staying here in Vietnam, you could look at a local provider. Where do you actually get insurance from? We'll look at 4 key areas. One is you choose not to have insurance. I don't recommend that. I've been doing this a long time. We see the situations people get into because they choose to wait too long before they look to take out a policy. Asking for insurance after something has happened is kind of like asking for car insurance after you've been in an accident. The next area, you can look at buying directly from a provider. Not all providers do direct-to-consumer business. Some only work with brokers like Tenzing. Now, if you go to a provider, they're going to offer you what they have. If you want to compare what they have with another provider, the language can be different, the benefits can be different. It's very confusing to try to do an apples-to-apples comparison. That's where using a broker like Tenzing comes in. Brokers like Tenzing, we do this for a living. It doesn't cost you anything more to use a broker, and you get the value-added customer service on your side to help you and your family during the year as anything arises, whether that's claims, direct billing, reimbursements, or any disputes. The last is to look at your employer-sponsored health insurance. If you're working here legally in Vietnam, you may get offered insurance as an employee benefit. My only advice is to check your policy, make sure you know what you have, and that the limitations and key features align with your expectations. If If it's not adequate, you could look at taking a top-up plan, which would cover on top of your insurance. So those are some areas to look at. Whether you use a broker or you buy insurance directly from a provider, keep in mind, insurance is all about covering future unknowns. You need to have a policy in place before something happens. Now let's make this real and look at an example. So let's say you're driving in traffic in Ho Chi Minh City and you have an accident. You fall down, you crack your shoulder, something's broken and you need to have surgery. Without insurance, you go to a private hospital, you go to a clinic, you're going to have to pay for that entire cost of treatment up front. Usually they will require a deposit. And then while you're there, that bill just keeps getting added to and added to. If you're there for 4, 5, 6 days, that bill can get all the way up into 5, 10, 15, 20,000 US dollars, depending on the severity and the care that's required. If you don't have insurance, all that follow-up care that's needed after you get discharged would be your responsibility. On top of that, now that you've not had insurance and you paid for this on your own, if you try to go take out a private insurance plan, it's going to be considered a pre-existing condition and you're not going to get that covered in the future by anyone. Now on the flip side, you have insurance. The same situation happens. You show them your proof of insurance when you're getting admitted or when you're getting checked in, and the insurance company and the hospital take care of it and you don't have anything to worry about. Which one sounds better to you? So what are some key takeaways? Rely on yourself. You can't control when something happens to you, whether that is an accident, a surgery, or a life-altering diagnosis. But you can control having a plan in place to protect you financially now and in the future. That's all insurance is. It's mitigating your risk and transferring your risk from yourself to an insurer. For that transfer of risk, you pay a price. That is your premium. That's the whole purpose of insurance. Now, my number one piece of advice is you always focus on a quality provider, inpatient only first. If you can afford outpatient, you can afford annual health checks, you can afford dental, that's great. That's a cherry on top. But the number one thing that you need to focus on is making sure you're with a quality provider who's there for you now and at your renewal date if something serious happens to you. Next is don't just look at premiums. Look at the benefits, look at the policy terms and conditions, ask questions. Cheap insurance is cheap for a reason. Health insurance is no different. It's not purely about premiums, it's also about what do you get and what are the rules of that provider. And last, use a broker. It doesn't cost you anything extra. We're here to help you from the very beginning to the very end of your customer journey, all the way through. We're on your side to help you as anything arises. That may not sound like a big deal. Go look at our Google reviews. People are very thankful that they're not trying to fight an insurance company by themselves when they're hurt, they're sick, and they're stressed out. So those are the 3 biggest takeaways about expat health insurance in Vietnam.